Hello and welcome to Health Communication class. I'm Dr. Bram Duffee and I'll be your instructor for this online course. This is an area of practice for me in my very own professional life, and so I'm excited to be able to share it with you in this format. So in this video, I want to tell you more about myself so that you can get to know me as your instructor, and then I want to get into the course specifics where we can talk about the assignments and the layout for what we'll be doing together. So go ahead and get the syllabus out or handy so that after I tell you about myself, we can look into it together. Well, to begin with, let's just talk about some ground rules for communication and how to best talk. You have my phone number, my cell phone number for emergencies, but the best way to communicate with me is by using the regular Kennesaw email account, not the D2L platformed email. So where you would go to your KSU email and then send an email to my KSU email. So my email address is bduffy at kennesaw.edu, and that's listed in the syllabus for you. And I just want to mention that because the goal is that I want to get your messages and respond within 24 hours or so. And for that to happen, we got to line up our messages in the same place. And also, we're communicating on the email system, but the assignments and everything else should be posted in the D2L system. So it's not good to send emailed assignments, right? So emails for communication and the D2L system is for assignments. So let's just give you some of my personal background. And as I said, my name is Bram Duffee, and I'm a scholar practitioner because I work as a researcher and also I work in healthcare. So you all probably figured out that I teach at Kennesaw State in Georgia, right? And at the same time, though, I live and work full-time as a paramedic in Houston, Texas. And then at the same time, I am a research fellow associated with the Institute for Social Innovation at Fielding Graduate University in Santa Barbara, California. So Santa Barbara, California, Houston, Texas, Kennesaw, Georgia, and I'm loving my life. So my academic background looks something like this. I have a research doctorate, PhD, in human development, and my first master's is in speech communication, and my second master's is in human and organizational systems. I also have a bachelor's degree in public relations, an associate's degree, and then the training for paramedic. So I have a paramedic license. And so that's all my kind of background for schooling. My research areas are focused on paramedic stress, paramedic conflict, and paramedic decision making. So like when it comes to paramedic stress, I might I'm known for talking about the most stressful moment that a paramedic might face. And when we look at conflicts, we look at resolution opportunities and classifying those. And so that's that kind of communication intersects with emergency medicine is where I'm at. I'm also a journal reviewer, so I am a reviewer for the Journal of Social Science and Medicine and also the International Journal of Paramedicine. I have written 2 books on communication, and the most recent book is called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. It's a book that I co-authored with 4 Arrows, published with the Routledge as the publisher, where we talk about using communication techniques to help the healing process. And how do paramedics talk to patients is what we look at. So for more personal stuff about me, I'll tell you that I'm married and like I said, live in the Houston suburbs. My hobby fun revolves around dogs. I grew up with all kinds of dogs, and I grew up on a fox farm. But right now I just have 2 dogs, a giant schnauzer, which is a big black 100-pound dog, and also a white Jack Russell Terrier. So those Those are my dogs and my home life. Now, my teaching philosophy is something like this. My approach to teaching and learning is that you have to do something to make your mind work. And that's the whole reason that we have course deliverables and we have the interaction requirement with others. I was thinking about this recently, and I want to mention my thoughts on how this kind of came together. You know, there are different ways that we can learn information and take in information. And to be able to get the information situated in our mind in the best opportunity for our learning, it requires that we have to move through the material at a pace that makes sense. And I thought about that when I was listening to a podcast recently, and I decided that I was going to change the podcast speed up to 1.5 times because I would be able to get through it. And I had to really concentrate to pay a lot more. It took a lot more concentration to pay more attention to that. But it also felt like I was running to catch up with a conversation and to keep up with a conversation. And the difference is that if you process things, then you'll recognize maybe that those moments between thoughts, that when the person's speaking, or the time that you have, can allow you to reflect and personalize that information so that you can compare that with your own experience and your own background and synthesize that information. And so that's what it takes sometimes. And so when we work together, that's the reason that we're doing all this communication and we're doing these assignments the way we are. All right. Let's look at the syllabus together, because if you open the syllabus up, you'll see just some of the basic information about the class, of course. That's COM 3320, Health Communication. And it's a 16-week class, August 12th to December 9th. And this is a totally fully online class that you'll be taking with me. My information at the top is listed there for you for contact information, including the all-important email address that I want you to use instead of the D2L when we communicate. And then my cell phone is in there as well. The course description says that this course introduces theoretical and applied aspects of health communication. Current health issues are examined in varied communication contexts, such as interpersonal, group, organizational, and mediated communication. This course analyzes provider-patient communication, intercultural communication, and health beliefs, and health messages in the media. A variety of contemporary public health issues are presented, and the course also examines the effectiveness of prevention messages using identified communication strategies. That's what we're doing. It sounds really complicated, but we're learning about messages and theories that surround how people talk about health, because there's a lot of cause and effect for us to go into. For this class, we will indeed need the textbook. And so the textbook is called Health Communication. It's by Harrington. And I use the 2014 copy. It's over, the one I have is over on my bookshelf, but it's totally acceptable to get a used copy of the book or whatever you can get a hold of. I personally have the first edition old one, that's from 2014. So it's by Harrington, Health Communication. The subtitle's Theory, Method, and Application. And the textbook's important because we're going to have required reading from the book that you'll need for the course. And so I want you to make that a priority and know that we do have reading requirements that are coming out of there. And it's a blessing and a curse. I know that it's a curse because you have to pay for the book, but it's a blessing because you don't have to hunt and go find all of this information in different places. I'm working with you to have it all mostly in one place. The other place that you're required to be able to have access is, of course, technology. And so there's technology requirements that are listed on the syllabus. And I need you to have your own personal working computer, reliable internet access, because we'll be watching videos, we'll be looking at journal articles in the library, and all those things are important for you to be able to do with me. Okay, so the syllabus has learning outcomes. And the learning outcomes that I'm going to read with you are directly in line with what we'll be doing in the class. So you'll notice that the conversations and the discussions about theories that come up will happen as the course progresses, but also in line with these learning outcomes. So one, identify multiple aspects of communication that influence health behaviors. Another one is to understand societal and cultural influences on population health. Analyze the impact of intercultural and organizational factors on healthcare. Recognize the value of using entertainment education to spread health awareness. Evaluate the strengths and weaknesses of past and present health campaigns. For many of you, because of the prerequisites to the class, you've already had some kind of communication class background. And so I don't think these terms should be a surprise or new to you, but you can see that we're going to be learning about how cultural elements of communication and behavioral elements of communication intersect with things like theory and how it impacts health outcomes. Cool deal? So there are a few course requirements that I want to talk about. I'll talk about the easy one first. The easy one is that the midterm and the final exam are each worth 15% of the grade in your class. So 15% for the midterm, 15% for the final. And those are both exams that you'll take through the quiz function in the D2L system, and they'll be open book. I will say that I will not be doing comprehensive exams. They'll be over select chapters, and it's important to prepare for those by watching the videos and reading the chapters before just diving into it, because there is some level of difficulty. It's not just a hunt and peck for the right answer to fill in the blank kind of exam. It requires some ability to do analysis, and not always easy to do on the fly. So preparation is suggested. So the way the exams will work is during the midterm week and during the final week, the exam will open up on Monday evening, and I'll ask that you have that done by the end of that week. And so before then, it won't be up or available. That altogether constitutes 30% of your class grade, right? So that means there's 70% of your class grade that we will be using the discussion board to talk about different issues and work through the material in the class. And so each week, I'm going to read this with you for the engagement and participation section. So as I said, 70% of your grade, right? So each week we'll utilize the D2L platform to engage in discussions revolving around our course materials, and you'll be tasked with responding to a set of questions related to the weekly topic and interacting with 2 of your peers' posts. So your initial post to the class should be on Wednesday evening before midnight, right? So it's almost midnight Eastern time. You've got to get those 3 points. You cannot be late. You have to have that post up, right? So initial post, we get up the response to the question or the essay or whatever is asked to you by that time. Now, that gives you 3 points. There's 2 more points that are going to be available that week, and the way it works is that you get 1 point for 1 point each for responding to your classmates. So the goal is for everyone to have their assignment or their discussion post up by Wednesday, because Thursday, Friday, Saturday, and Sunday, you want to be able, as a class, to read each other's work, comment, discuss, and continue the conversation. And so the initial post is 3 points, and then follow-up posts are 2 points each. So when you see that we have anything discussion board related. Anything discussion board related is going to be a 5-point value, 3 of which come from your main post, 2 are for the follow-up post. I wrote here, further specifics about these discussions are going to be provided within the lecture video for each time, and you should prioritize viewing that lecture video before crafting your discussion board post. Each discussion response should be well structured in paragraph format, not bullet points. So I'm not a fan of reading bulleted points in discussion posts. So I'm going to tell you that the follow-up discussion posts are designed to continue this whole class conversation. And I don't expect that anything really is going to get posted that is going to be less than 3 sentences in a post. And so saying, oh, great job to someone or nice point, that does not count. So we are thinking about what they said and adding to that conversation or suggesting something or pulling in an outside resource, or in general, think of it as if you were in class and participation points come that way. So that's 70% of your class grade, and it means that to do well, we have to stay up with the class conversation. I will be there with you, and we'll be participating and reading and commenting, and so all of it happens together as a class at the same time. There's a evaluation section that I have listed in a grid format that shows weeks 1 through 16 so that you can see each week and what's due and what do you get credit for. So week 1, you have to do a discussion board. It's going to be worth 5% of your grade. And remember, that's pretty easy to figure out because each point is worth something. 3 points for the post and 1 point for each of the student reply posts. So if you're following along with me under that evaluation section, you'll see that weeks 1 through 16, you do a discussion board every week, except 2 weeks. The 2 exceptions are your midterm week and your final week. In the midterm week and the final week, you have exams. So that shows the layout of how you'll do well in this class to gain points, because all of the assignments for the class have a raw numerical score, and final grades are going to be based on the scale that I have shown up here, where an A is between 89.5 and 100 points, and a B is this, and a C is, so forth. So it's listed there under the grading policies already mapped out by the school. It's just that you will be building your grade as you go. Your points accumulate. And so missing points means that your grade is automatically going down. And so we don't do makeup work. We don't do bonus work. And I want to mention this as part of what I have in the syllabus for you, because getting the grade that you want does not depend on depriving somebody else of the same grade. So you're not competing with your peers for grades. And I don't grade on the curve, although I may compensate in your favor if in retrospect I feel like I graded too harshly, or if I make a mistake, you will be the person that gets the favor in that situation. But work that meets the minimum requirements of an assignment is a C grade assignment, average. And work that's basic but has lacking a lot of substantial effort is a D assignment. And so these kinds of things are important to think about at this level. And if you pay attention to quality, it's going to result in better grades. And I believe that an above average effort demonstrates that you use knowledge and comprehension of the course material and also apply it. And that means not using ChatGPT just to throw down an answer, when that is the most boring stuff that we could ever get. In all actuality, we need to hear from your mind and what you have going on. And applying facts are important, but an exceptional effort that's that's required of you to pay attention and do well. And so I have listed on here your attendance requirements, saying that this is an interactive class, and so I'm asking that you adequately prepare by reading the assigned chapter, listening to the lecture, and preparing for your answers before you do them, or your test before you take them. All assignments are due in D2L. Also in the assignment policy, I mentioned that late assignments are not accepted. And that means that if I haven't heard from you and it's after the fact, then there's not a way I can fix the problem, right? So if you have something happen where you need an extra time for something, then I need you to request that before the deadline. After the deadline happens, it's too late to be able to fix the problem there. Got it? So that's part of the assignment policy, is that we're not doing bonus work, and I'm suggesting that if you need to be late, let's try a couple days out to let me know and ask for an extension. And that way your grade won't be affected. Speaking of grades, I have incomplete grade policy there. The communication with instructor policy I talked about, let's do email mostly. Other things that are listed under the department college policies are things like academic dishonesty and plagiarism. I'm asking that you don't use someone else's work and that you do use your own thoughts and ideas, because if you don't, then sometimes we get into positions as instructors where things are out of my hand. And I have been in quite a few situations in my teaching career where students are in trouble, and it's very problematic for them. And so I don't want to go down that road with anyone. Please, let's just work hard together to learn this stuff. I have on the syllabus the reasonable accommodations policy, and that's a policy that lets you know as a student that if you have a disability, to please contact Student Support Disability Services, and the website and the information is linked there, because getting your disability on file allows that particular department to communicate with me what your needs are, so that I can make accommodations. And the next section on there talks about an enrollment management policy, and that's to remind you as a student that just because you stop going to class doesn't mean that you aren't still in the class. So it's important that you don't ghost me, and that you talk to me about what's going on in your life, and if you need to drop the class, that you do it formally and don't just give up, right? Because there are ways that we can help you along the way, not just from me as the instructor level, but also at the administrative level, to help get you through when we understand what's going on. All right. So the FERPA policy is listed there, and that's just a policy that reminds you that your information is private, and as your instructor, it's my job to keep it private, and there's laws that protect your information. The last page of the syllabus is the course schedule, and it says on there, the information depicted below is a representation of what will be accomplished weekly, but it's asking you to see specific due dates for each assignment deliverable. Okay, so what's nice about this chart is that you can see each week and what we'll plan on doing and what chapters that you'll be assigned for reading. So the first week, they're listed 1 through 16, but the first week is August 12th. So that started out our first week of class, and we're going to be talking about Introduction to Health Communication Theory in Chapter 1. And then the next week is going to talk about, we're going to focus on the patient experience. And the week after that, we'll talk about working to understand caregiver challenges and social support needs. The week after that is providers' perspectives. And then after that comes team communication and looking at different approaches to how we study communication. These things help us get healthcare, help us figure out how to understand this intersection. So listed there also is the information about when your midterm exam is and your school break, which is November 25th through December 1st, which is right up before the final exam week. So if you have any questions about how this is going to roll, I want you to contact me. But in general, I'm excited about this semester start. It's neat that I got to tell you a little bit about myself and my family, home life, and also my approach to this class and how we're going to work together to add up these points, to get these points as we go through each week to do the discussion board questions. So remember, discussion board is due on Wednesday night, and all the follow-ups are due before Sunday night at midnight, and that is 70%. So if just chugging along is enough to really help you get there. So congratulations on your first lecture, and I am excited about our next steps when we look at the class topic and your next lecture video.